Well, good morning, everyone.
Good morning.
I'm excited to be here at the Ward 8 Health Council led by our illustrious leader, Jern Hill-Lockridge. Give a round of applause for Jern. She's just a joy to work with, a fierce leader. I'm happy we chose her to lead this great organization. I want to thank all our partners because you all give us the insight and wisdom on policy decisions, budget decisions, because we don't know everything at the council, as you may know. And so we lean on you all for just input through the Ward 8 Health Council. I want to thank you, Jern, for just a strategic plan and advising us on what direction we should go based on the leadership of you guys that's doing the work each and every day in the trenches. I want to thank Dr. Daniels. As you hear, we've had a lot of friction with the hospital, as you can imagine, over the course of time. We've been going up there complaining and representing the community, but she's been answering our calls, even up to yesterday. I had to call her yesterday, and she responded about a constituent's issue, and I want to thank her for that. Even Dr. Quarters, raise your hand, Dr. Quarters, in the back.
Hey, Dr. Quarters.
Hey, Dr. Quarters. But Dr. Quarters, Jern, some of our community leaders had a long meeting with Cedar Hill about a month ago, and they've been following up on that in the hopes that we can follow up with you, Dr. Quarters, about get some delivery, and not just conversation, but for your leadership and bringing the doctors, get the community doctors to that meeting to ensure they have a chance to work with the community, and they have over 40 years of experience working in this community. So I want to thank you for your leadership on that. This morning, I wanted to talk a little bit. I have about an 11-page presentation, but I'm gonna try to skim it up to 9 more minutes, Ms. Jern. We in the District of Columbia are facing some budget pressures. We are projecting to have a $700 million a budget fall in 2027. And so in doing that, we are working with the mayor's office, the city administrator, chief financial officer, and Deputy Mayor Wayne Turnage to address some of these issues when it comes to our healthcare services, when it comes to Medicaid, and also the Alliance. In brief, based on what was presented to the council last week, I'm gonna just go to some of these points to relate to you guys. The purpose of this conversation is so you can know, so you come and advocate for the interests of your clients, your organization, your business down at the council. And I'll leave some of those dates before I close out. Absent any policy changes, based on the direction we're going in with the need of those who are on Medicaid, Medicaid costs will increase about $297 million within the next 2 years. And we're trying to figure out how do we save money without hurting the common people with having quality healthcare services in a 4-year plan. Medicaid insurances make up about 86% of DC healthcare financing funding. With CHIP funding, Medicaid make up about 6%, which is 16,321 participants. The adult alliances make up about 6%, which is 18,756 participants. And alliance children make up about 2% of this fraction, with other DC residents making about 59% of other healthcare insurances, totaling 702,250 residents who are dependent upon DC healthcare financing services and funding for healthcare insurances. There are a lot of potential changes that's going to happen to these services that the Mayor Bowser and her team is proposing, and then the council is going back and forth about what we want to accept and not accept to ensure that we don't adversely affect those who need our healthcare system most, especially our seniors, our families, and our babies. I do know one of the things that I've been given pushback on is the way that they are doing the re-enrollment. Coming out of the pandemic, people were automatically re-enrolled into the system. Now they are requiring re-enrollment through the portal, through going in person, just different mechanisms to get people back to the system. And some people may not know how to re-enroll, because if you historically been automatically re-enrolled, you might think you're going to be re-enrolled again. And to me, this may be a barrier for re-entry for those who have literacy issues, those who have a digital divide with the computer or may not know how to use the computer, or those who may have issue with transportation going down to our social services building to re-enroll. And so there has been many efforts trying to get people to re-enroll, but that is a barrier, and we are seeing some reduction in re-enrollment based on the new criteria that DC government is rolling out. So I just want you to be aware of that. We have to do more to ensure that people are re-enrolled and have access to quality health care in DC. Based on the 2027 budget, we are facing projected alliance spending offset of $95.2 million, FY 2028, $21 million, FY 2029, $21 million, and just the total for four-year cost for the financial plan is $279 million, and in the grand scheme of things, it's going to be a total of $297 million over the course of 2 years in projected over cost of spending based on the projections by the Chief Financial Officer in the Healthcare Finance Agency. I'll jump to this chart. You probably can't see it, but DC projected costs compared to what was needed. So in 2025, DC projected $988 million in healthcare costs, but it spent $1.1 billion. In FY 26, it's projecting $1.04 billion in costs, but it's projected to spend $1.25 billion. Now we're skipping up to 2027 because, as I mentioned, we are facing a $700 million shortfall, and then we're facing a lot of implications based on what the federal government and Congress is doing to DC budget that may have adverse implications on our budget and financial spending. So we're projected to spend $1.05 billion, but based on our previous numbers, it may go up to $1.1 billion. And this is a large cut in the $20 billion budget DC is projected to have. And just beyond healthcare, I know we're in the front of the Healthcare Council now, but what happens is when DC business community suffers, the DC budget suffers. So we don't have as much money to spend on our priorities, and that includes inflation and all the other pressures we have on the District of Columbia. But I always say that we have the money to do what we need to do. It's a matter of priority. It's a matter of where we want to spend our money. Because we have more money right now in DC history, we ever had in DC history. And I've seen us do more with less. So it's a matter of us coming up with a plan and about how we want to spend our money. There's been a back and forth right now over a pot of money of $50 million of how we want to spend it between the mayor and 13 council members who are very different. And so the council met yesterday trying to hash out what we want to do with this money and how much we want to be projected to spend, adding to the Potomac River spill, because there are going to be some incurred costs, mainly on Maryland, but DC is going to have to contribute something to ensure that we are remedying this situation. And we met with DOEE, we met with DC Water and some of our partners yesterday to figure out how we're going to do that, but this also will have an impact on our reserves and our spending. So we are going through an extensive list at the council of things we want to spend money on: housing, public safety. You can imagine the list is long, and we're narrowing that down to get it back to the mayor because we do have a pot of $50 million that's what's supposed to been spent, but the mayor hasn't spent the money yet. And so she wants us to change the list, and some council members are like, we're not going to change this is our list. And so it's an ongoing back and forth, but nonetheless, it's happening now in the midst of what we call budget season. There are ongoing health hearings chaired by Councilmember Christina Henderson. One is going on right now today, which I have to zoom back down to be a part of a few hearings today. I need Sheila Bunnis here, nod her head, and my chief of staff. Raise your hand, Sheila. Sheila Bunnis here, thank you. But as mentioned today, there is a performance oversight hearing today in the Wilson building. There's one on Friday, February the 20th at 9:30 a.m., room 412 in the Wilson building. This is the performance oversight of the Department of Health. These will be government witnesses only. Please note that. But we are welcoming emails, conversation, add to the conversation so we can make informed decisions from those who work with the population of our people each and every day. There's one on February the 24th at 2 p.m. in room 120, and this is the performance oversight hearing. And it's going to focus on Department of Insurance, Banking and Securities. There's one on March the 4th, 2026 at 9:30 a.m., room 500. And this is a performance oversight hearing on DT Health Benefit Exchange. So if you are in those areas, if these topics affect you directly, please have someone from your organization, your business, to send an email, send a correspondence, a testimony, or come down. And most of these are accessible by Zoom as well, so in person, but also online for those who can't make it in person. It's very important that we hear from you with these budget pressures, because the squeaky wheel gets the oil. And there are other organizations, businesses, priorities, people who are coming to the council, letting their bell ring about what they want to see happen with the budget, and we want to hear from you. So I want to thank you all for having me this morning. I'll pause for Ms. General Hill-Lock just to give me some direction on next steps.